Hey, welcome back, future nurses. I'm Dr. Kathleen Jude Estime, and I'm psychiatric nurse practitioner. And today we're tackling TBI, traumatic brain injury, for the NCLEX scenarios, one of the essential areas every nurse needs to master. And I've got you covered. And remember, whether you're studying with my digital products or joining me on my tutoring sessions, you're building confidence until you pass.
Hello, whether it's good morning, good afternoon, good night, good evening, whatever. I am Shirlene Roll, nursing instructor and owner of CNT Tutoring Services. I'm joining my colleague, Dr. Kathleen Estime, this evening to go through some would-be scenarios that would possibly show up on an NCLEX exam and to help better prepare you, the future nurse, who is all excited about taking the NCLEX. We want to ensure that we give you the necessary tips to help better prepare you to choose not just the best answer, the correct answer in the quickest amount of time with confidence.
Question 1, critical thinking and safety. Here's our first scenario. A client with a recent TBI is unresponsive and has a Glasgow Coma scale of 9. What should the nurse's immediate priority be?
Pause and think. Should we assess airway patency, administer oxygen, or alert the rapid response team? Always remember, monitoring a patient with a TBI is critical. Timely assessment can be life-saving in an emergency situation.
Question 2, Glasgow Coma Scale. Can you recall what the 3 components of the Glasgow Coma Scale are? How do you interpret a score of 15 versus a score of 8?
Hint, remember the GCS evaluates eye-opening, verbal responses, and motor responses. Here's a tip. One way to remember is to think of the acronym EVM for eye, verbal, motor movement. For each component, visualize a range from full alertness to deep coma.
Question 3, therapeutic communication. A client with a TBI expresses feelings of confusion and anxiety. What is the most therapeutic way to respond?
Hint, avoid minimizing their feelings. Instead, acknowledge their concerns and offer support. Here's a teaching moment. Therapeutic communication is crucial in nursing, especially in conditions affecting cognition. My worksheets include role-play scenarios to help practice this.
Question 4, medications. Your client with a TBI is prescribed mannitol. What are the critical things you should monitor while they are on this medication?
Think about fluid balance, serum osmolarity, and signs of electrolyte abnormalities. Another teaching moment, medications related to TBI management often surface on the NCLEX exam.
Question 5, delegation and scope. When managing a patient recovering from a TBI, which task can the RN safely delegate to the LPN or CNA?
Hint, consider who is qualified to perform simple tasks versus those tasks requiring critical thinking and judgment skills and assessment skills. Another teachable moment. Understanding delegation is pivotal. I emphasize real-life scenarios in tutoring to reinforce your grasp of the scope of practice, RN versus LVN versus unlicensed assisted.
Question 6, complication scenario. A client with a traumatic brain injury starts developing signs of increased cranial pressure, ICP. What's the best initial nursing and intervention?
Pause and think. Should we check vital signs, administer mannitol, or position the patient to promote venous drainage? That teachable moment again, always prioritize assessment, especially in serious situations where time is of the essence.
Question 7, long-term care planning. For a client with a traumatic brain injury, what important factors should you consider when developing their long-term care plan?
Think about cognitive rehabilitation, support systems, and occupational and physical therapy needs of the patient. Another teachable moment, holistic care is essential in nursing. My guides cover rehabilitation strategies and long-term recovery considerations to support your studies.
If you found these questions helpful, don't stop here. You can grab my NCLEX digital TBI study guide, or sign up for tutoring. And remember, my NCLEX review program includes weekly TikTok lives and Sunday Zooms. Stay with me until you pass. Visit my stand tree in the bio to get started. See you in the next episode, and remember, you got this.